Hey everyone, welcome to MyoLab. My name is Dr. Evan Schwindt. Thanks for tuning in. Kevin, let's get down to work. Today we're going to review myofascial release or rolling for your hips. Important concept with rolling is we need to ensure that you're in some discomfort but not pain. Typically I talk about hitting about a 6 out of 10 for that discomfort or pain, okay? If you go above, you hit 8, 9, 10, very likely that you're going to be a rigid body, not get the results that you need. Now, typically speaking, we're going to be doing rolling because we need a muscle to relax. We want the tension to reduce. So in order for that to actually be achieved, we need to be rolling until the pain reduces by half. Now, most research has shown that that's going to be about 3 to 5 minutes. So if in fact your goal is to get more mobility and reduce the tension, if you don't have at least 5 minutes, don't start a rolling regime. Now, the second utilization of rolling is going to be, let's just say you have an important event coming up right away, a tournament, a game that's coming up that you are in pain right now, but you need to get through it. That's when you do a completely different setup, and that's where you go for pretty intense pain, about a 9 out of 10 for pain, and go for 30 seconds only. The goal of that is desensitize the tissue. Now, this is a risky thing, so we got to be smart about it because it could cause further injury. But if this is just an isolated discomfort, 9 out of 10 for pain, roll that for 30 seconds to desensitize it, but then please make sure you see a healthcare practitioner afterwards and start the actual process of rehab to make sure that you do not have further catastrophic injury. So again, there's the two reasons that we're going to foam roll. That's important. When I say foam roll, that can also be a lacrosse ball. It can be a tennis ball, a golf ball, really any sort of a structure, a water bottle, a wine bottle, whatever it takes, whatever you have on hand. Let's go ahead and make sure that we are rolling correctly, taking care of your body. 2 reasons: desensitize so you can get through an important bout of exercise, or to actually relax the muscle, calming it down, improving your mobility. So today, we're gonna go ahead and review the hip specifically. We're gonna start off with rolling of our Tfl muscle. The Tfl muscle on the side of the hip, it goes down and creates our IT band. On that note, please stop rolling your IT bands. It's a waste of time, it's painful, you're not gonna change the tissue on the IT band. The IT band really comes from the Tfl. That Tfl muscle, that can actually be released. So let's focus on that today. As it's right on the side of your hip, its primary goal and function is to raise your leg to the side. Secondarily, it's also really important to ensure that you don't dislocate your hip. Now, when we don't use our glutes, we end up overusing our Tfl. So you're gonna roll onto the ball, find that spot that's, again, at least a 6 out of 10. If it's not a 6 out of 10, it's not worth your time. You want to support the rest of your body, because the last thing we want is you to roll on a certain muscle. That feels better, but then somewhere else in the body starts to get worse. Now, as you're on this spot, again, it should be uncomfortable. 6, 7 out of 10 for pain. But somebody should be able to come by, lift your leg, and let it flop down because you're relaxing. If you're rigid, it's not going to get you that relaxation that you need. Stay on this until the pain reduces by half. Now, rolling, you can also do 3 different ways. Static, just rest your body on it. Or you can go ahead and move your body over, and again, it doesn't matter which angle. Could be different for you based on the fibers that are affected. Third, you can pin that muscle down and move your limb to stretch it out. That's a pin and stretch movement. Usually I do progress through those 3 ways in that order: static, rolling, pin, and stretch. Now, once that muscle is reduced by half in intensity, let's go on to your glute. Glute, the primary hip extensor. Throw that back, find a spot that's at least a 6 out of 10. And then we have multitude options here. So we can go into a figure 4 position, stretch that out. Again, static, roll, motion. Maybe that's too intense. Let's just start with straight leg. Bend the heel towards your butt. In any position that you end up feeling, there's no right or wrong answer on this. Move the hip through it, and you might find, yeah, that's the spot that really gets some irritation. Then work that through until the pain reduces by half. The next muscle we're going to focus on is the quadricep muscle. So you can utilize really any angle of the quad, and it's important to get through all of them to ensure the quads are released. When we're talking about hips, really the upper, the proximal portion of your quad is the primary focus that we want to look at today. So you're going to find a spot, pin that muscle down, relax the body so we aren't in a contorted position. First, start by just resting into it. If need be, we can go into the next level and roll again in any direction until the pain reduces by half, or pin the muscle down and flex your ankle towards your butt. Now again, I'm just going to demonstrate with the foam roller for each of these real briefly, because you can utilize any instrument that you wish. For TFL, side muscle, hold it down, pin it, move over top of it, pin and stretch, moving the leg. For the glute, first find your spot, go into a figure 4 to stretch that glute, roll over top, go through motion, quad. You can either start on the outside, straight on for rec fem, inside for vastus medialis. Find the spot that's most tender to start off. Roll back and forth. Heel to your butt. Again, do that until the pain reduces by half. Also important in the hip complex, when we're going through some rolling to help out your hip pain, is going to be the diaphragm muscle. This might come to a surprise to you. Really, this is important because the hip flexor starts down to the hip, wraps around the stomach, shoots through the diaphragm, which is our primary breathing muscle, and into the mid-back. So typically start with a tennis ball. You can eventually get into a lacrosse ball. What we want to focus on with a diaphragm roll is the diaphragm is right below, really behind the lower rib cage. So we want to make sure we find that spot. It is a U-shaped muscle, but usually as you go down, you're really not going to feel any tension. So stay along the rib cage. Please do not apply the pressure onto your rib. That will cause quite a bit of pain, potentially even a fracture of your rib. So start below, pretty close to your midline. Roll face down. Again, keeping that body straight as opposed to contorted. What we want to do, we're just below the rib line, so we're going to sink into it. Now, once you're sunken into it, I want you to focus your breathing directly into the ball. Remember, the diaphragm is a breathing muscle. So we better activate it with some breathing. As you breathe into it, you're definitely going to notice an increase of pain. Oftentimes, people actually refer to this discomfort similar to how anxiety feels. So we want to breathe into that until the pain reduces by half, which is usually 3 to 5 minutes. Now, let's say you're able to do that just fine. Let's go into the final progression, which is a baby cobra. Little baby cobra, and continue to breathe into it. Now, what you're going to notice with this, after you release it for a few times, the ability to stand up straighter, sit up straighter, and take deeper breaths of air. Kevin and I want to take this time to personally thank you for watching today's video. Now, if you're in the Calgary, Alberta area, please be sure to check us out at myolab.ca, where you can book online 24/7. We also direct bill to over 20 insurance providers for your convenience. We have a fantastic team here to help you out through any of your needs. If you have any questions from today's video, please be sure to leave a comment down below. If you like what you saw today, please be sure to smash that like button and share with any of your friends. Please also be sure to hit that subscribe button and follow us for our next video. You might see some other videos to the sides today that might benefit you as well. Lastly, please be sure to follow us on Instagram at myolabyyc. Take care.